Hello, everyone. Hi, I'm Susan Cole,
And I'm Matthew Hodson.
and welcome to aidsmapCHAT, our live show for people all around the world about issues around HIV and sometimes COVID.
Yeah, and we've got another fabulous lineup of guests for you this week. We have Dr. Tristan Barber from the Royal Free Hospital, and he's here to talk about the COVID vaccine and how that may impact people living with HIV. We also have someone who's totally unique in the world. He is the only person who's still living who has actually been cured of HIV. And as our final guest, we're very excited to welcome back to the show Dr. Sindi van Ziel from South Africa.
Fantastic. I'm really, really excited about this show.
It's a really strong lineup. It's got like some. I think we're going to have some really fascinating stories this week. It's really good. And this week, it has been World AIDS Day. How was that for you, Susan?
It has been pretty intense. I mean, I've got a really mean boss that sort of like overworks
I hear
me.
that,
Yeah.
but I hear he's like super hot, so it's not all bad.
So I've been very, very busy, as many people working in HIV have been this week. But it's been quite full on. I did a broadcast, a presentation yesterday for about it was over 1,000 people, and then the smoke alarm went off in my house. So that's one of the perils of doing these things from home. But it's a really important World AIDS Day, I think, this year. I mean, the theme is global solidarity, shared responsibility, and it feels more pertinent than ever as we go through another global pandemic. And I think we've really seen with COVID, when the world comes together, what can be achieved with the progress that we've made with the vaccine.
Yeah, yeah. It has
And,
been. It's been a more of a global year in some respects because of COVID than how things normally are.
yes,
Yeah.
and what does World AIDS Day mean to you, Matthew?
Um. Well, I think for me, World AIDS Day, it started off and it was about honouring those that we had lost. And because I am of that age, I mean, I went to more funerals of my contemporaries when I was in my 20s than I did when I was in my 30s or my 40s or so far in my 50s. And we used to, we'd carry our candles and we'd go to a church and we would remember those that we lost. And I think for many years, I almost pushed that grief down. And then as we started to have more success in treating HIV, and as we started to really have an impact on those numbers, and when we start talking about equal life expectancy, it's almost like it gave me the opportunity to remember again. So in some ways, in the last couple of years, I felt that grief, and I remember the people that I lost, and I think about James, and I think about Ray, and I think about Roy, and I think about all of those beautiful young men who didn't know what it was like now, and I think about how can we best honor them. And obviously we've got to honor them by ensuring that their legacy, the treatments that they faced, which paved the way for the treatments we have now, is honored. And that is, those treatments also paved the way for PrEP, which can prevent new infections. More than that, I want to honor them by saying we need to challenge the stigma that people living with HIV face. So this year, I'm wearing my red ribbon, but I'm also wearing a plus VE badge because I think it's only when people who live with HIV are open and honest and able to challenge that fear and challenge that ignorance that leads to stigma that we can change things for people living with HIV. And I think that's the greatest tribute we can pay to all of those who died of AIDS on World AIDS Day and throughout the year.
That's wonderful.
Thank you.
Well, well, I think that we need to move on to our first guest. We mentioned COVID. If only we had someone that could tell us everything about COVID vaccines.
We're
Dr. Tristan
asking a lot
Barber.
of you, Tristan Barber of Royal Free Hospital. Tell us everything about COVID vaccines.
Everything.
Well, let me start back in January.
Tristan, it's wonderful to have you back on. So many questions about COVID. But one thing that I'm hearing a lot from people is that they're nervous about the fact that the COVID vaccine has come so quickly when it's taken so much longer for other medications to be made available. Is this something that we should be worried about?
Well, thanks very much to you both for having me on the program again, especially this week. I know it's been a really busy one for everyone. That's a fantastic question, Susan. I think we all are nervous about things that come to use in healthcare very, very quickly. Certainly those of us that have been in the HIV sector for a long time will know that we get very excited about new medicines, and of course we need to see what they are like in real life when we start using them. But I have to say the global effort really to develop these vaccines and to ensure they're safe has been really, really thorough. I mean, the UK for some time has been a global leader in vaccine development. So I think we were primed to run very good and rigorous studies in this field. I think what is very relevant for people that will be listening to this show is to be aware of whether or not these vaccines have been tested in people living with HIV infection. So some studies have included people with HIV. Some studies rather have had different criteria for people with HIV as to whether they can be in the study or not. And others have not included people with HIV from the outset. So whilst we have no reason to think that people with well-treated HIV, undetectable viral loads, good CD4 counts should be any different to anyone else when receiving a vaccine, I do think we just have to keep an element of caution in terms of ensuring that the vaccines that we're using have been tested in all populations so that we know they're going to be safe. But I certainly feel very confident that when I'm offered a vaccine, I will take it. I think if there is good data about generating antibodies, then I'll be reassured that I'll be protected, and certainly I'll feel that there's been enough data to say that these are, for the majority, very safe.
Yeah. So the Pfizer vaccine, which is, I mean, obviously that's been grabbing the news because that's the first one to be rolled out. We're expecting rollout to start next week, I think, aren't we? Do we know were people with HIV involved in the trials for that?
That's a very good question. I don't know for the Pfizer study. I have to say, we haven't been involved in the Pfizer study locally, and I haven't looked at those data yet. I should have looked today. It's been one of those very busy days that we've all had this week, and I'm not currently aware. So perfect question, because we need to check.
And do we, because obviously the different vaccines, I mean, we've heard, really exciting results from a number of vaccines now, and they have different mechanisms whereby they work. I mean, do we think that is there a possibility that some of those mechanisms are safer for people living with HIV than others?
I think that's also a really interesting question. So if we look at the vaccine studies I can talk directly about, we know that the Oxford vaccine study run in conjunction with AstraZeneca is currently running a sub-study, which I think is recruiting 55 people with stable HIV infection to look at safety specifically in an HIV population. Now, that vaccine includes using a different virus to carry a protein of the COVID virus for people to generate immunity. So that's a specific, if you like, way of delivering a vaccine that the Oxford group have used, and they are specifically looking at safety in an HIV positive subgroup. We also have another study running at the moment called Novavax. We have that running here at the Royal Free, and that study now includes people with stable treated HIV infection as part of the main overall study. But again, those two studies, the Oxford study has reported partially, but we've not seen that HIV specific sub-study reported yet, and that will still be some time down the line. Novavax has not yet reported. As far as I'm aware, I don't have any reason to think that one particular vaccine will be more risky or more safe, to look at the more positive angle, in people with HIV infection. I think we really just have to wait for the data.
Right.
And Tristan, Tristan, would you say that that HIV will count as one of those underlying health conditions that for people with HIV will be prioritised for receiving the vaccine?
At the moment, we still don't know. We know that HIV, again, for people who were stable on treatment with good CD4 counts, people who had well-controlled HIV were not deemed in the UK to be at risk enough to be on this shielding list. So if we're thinking about prioritization, although that shielding list I don't think will directly translate into people who are prioritized for vaccine, it might give us an idea that HIV might not be perhaps bumped up the list necessarily, if you like, because as we say to people all the time, if you're on treatment with a good CD4 count, your immune system is working pretty normally, so we don't necessarily think you're at huge extra risk. There was some data in the UK showing that if people with HIV do get COVID, then perhaps they have slightly worse outcomes if they're hospitalized, but a lot of that seemed to be driven by traditional risk factors as well, that we already know about. So we have to think about people being older, people being overweight, and so on. And of course, those groups will be in the prioritization category. So we anticipate that people that are over 80, over 70 will be in some of those first waves for vaccination. We anticipate that frontline healthcare workers will be fairly near the top for vaccination so they can keep working and keep everyone else well safely. And we anticipate that those in care homes will also, of course, be prioritized. And so that would be regardless of whether you're living with HIV or not. But at the moment, I'm not sure that stable, controlled HIV with a good CD4 count will put you in an early prioritization category, but I could be wrong.
Right. Tristan, thank you so much. It's been really wonderful to have you on the show as always, and really fascinating. I mean, this is such an exciting topic right now. Thank you.
It's really exciting. Thank you both.
Thanks for coming on, Tristan. See you again. Bye. Oh gosh, I think it's an area that's really consuming so many of our thoughts. How are you feeling about COVID vaccines?
I cannot wait to get my hands on the vaccine. I have missed hugging people so much. I just want to. It would be lovely. Susan and I, we see each other like so often via these mechanical devices. We haven't seen each other in person since March. And within HR restrictions and all of that, I would love to give you a big hug right now, Susan. Yes. I really look forward to that. And I really look forward to just that kind of relaxed interaction with people again. How about you?
It's hugely important to me because, as you know, I live in a multi-generational household. My mum is 86. So I know my family have sort of been living in a bit of a cloud because of COVID. And it's been a real issue in terms of juggling, keeping my mum safe and looking after the emotional well-being of my kids. So when a COVID vaccine comes, it's going to be hugely important for my family. But I do have some concerns more widely for people of colour, because I'm hearing a lot of people being a little bit concerned about having the vaccine. And I think quite a lot of that stems from the historic medical abuse that people have experienced for years and the disrespect that people have experienced. So I think it's very much a case that healthcare professionals have to listen to people's concerns, have to treat people with the respect they deserve. And also what's crucially important is that people need accurate, reliable and accessible information about the COVID vaccines.
Absolutely. We talk about it quite a lot. It's making sure that people are informed, equipped and empowered. And, I absolutely understand the fears that many communities have. And I think if we are able to be, if we are honest and we talk about how we are confident with the safety of these vaccines, that will help. But we can't dismiss these fears. These fears are based on a history which it's terrifying when you look at it, and so we've really got to respond in a constructive and non-judgmental way towards this to make sure that as many people as possible benefit.
Absolutely, yeah. And that makes me think of a study that we covered on AIDSmap recently by Dr. Rageshri Darawan, who's been on here, and she found that people from Black communities living with HIV were more likely to have viral rebounds and more likely to disengage with care. And again, I really feel that a lack of accessible and adequate information really plays a role. And I think that healthcare professionals have just got to step up also with signposting people for the support and the issues that are important to them, like immigration concerns and housing issues and poverty issues.
Yeah, I read someone saying the other day, they said, I can't think of a single health intervention that would be better for all people than alleviating poverty. And I was like, oh, that's good. I'm going to use that. I thought. Let's get on our next guest on, because our next guest, I hope he's here. It is Adam Castillejo.
Hi.
Hi,
Adam.
Confession to the audience. Before we went on air, Adam was not with us, and so this is actually the first time I've seen you, Adam.
Thank you for having me.
I'm so glad you're able to make it on.
Yeah, we had some issues, but we're here. I'm here.
Brilliant. So, Adam, you were known for a while as the London patient because you are the second person ever to have been medically cured of HIV. So what?
Yes.
So give us a bit of the background, because the treatment you went through was an unusual treatment. It was a quite extreme treatment. So why were you put on that course of treatment?
Because my cancer was too aggressive at the time, and my lymphoma, it was very aggressive. So I have to have a stem cell transplant. That was my only opportunity to survive, to actually get into remission, to cure the cancer. But people need to understand, being an HIV man, that treatment is not available widely in the NHS and worldwide. No many doctors and consultants and professors willing to do that because it's higher risk. And I got this amazing opportunity by Professor Oliveira and Hammersmith, Dr. Ian Gabriel, who gave me the opportunity, and now led by Professor Gupta. And yeah, they give me the opportunity, but the opportunity doesn't come easily to any HIV person suffer from cancer these days. So, and I hope me talking about it, how difficult it is, and how you still stigmatize sometimes having HIV and dealing with cancer. So it was really challenging at that time. So I want people to understand this is something most doctors around the world will not willing to do, because it's about 80 to 90% possibility to die. So it's not as simple and people think you're going to get it. I get tons of emails, text messages, and all social media asking me, how can I have it? Can I get it? And I try to be the best as I can to tell them it's not easy for everyone. This is for cancer. But this lead the way, and that's what Professor Gupta and I, we always want to make sure people understand. This is the door and the window to find a more feasible cure for everyone. And I keep helping them, donating blood for the research to try to give it to the community. I think I believe I got in this position, and I want to do the best I can to help the crusade to find a cure for everyone. So that's what I'm passionate about it.
Yeah. So how did it feel? I mean, because I know that other people have been through, not many, because it's such a horrible procedure, but there have been some other people who've been through the procedure and they weren't cured. It's you and it's Timothy Ray Brown, who very sadly died earlier this year, not of HIV-related illness. But when they said to you, "We think you're cured," I mean, how did that feel?
It took a while. I was quite apprehensive because for me, being an HIV man, and now I felt like I have a double take. So I have to wait for the results, feeling, oh, I'm a HIV again, or I am not. So it was a really strange place to be, because happened in 2003 when I realized I was HIV, but in 2018 and 17 when we stopped, I say to myself, oh my God, I was really apprehensive. So I have to have some help, and to feel kind of, I couldn't, it was only Timothy who really understood me because he was in the same position. Being an HIV man and now reaching out, it was kind of me living again the diagnosis in 2003. It was like, oh, I am HIV or I am not. When we find out the first month, it took a long time. I was like, oh my God, this is happening. And it's working. And he said to me, Adam, we have to wait at least for 6 months to see if something really can we talk about it. If you are cured or is in remission. After 6 months, then when I went, yeah, I went happy about it. But it took me a time. It took me a time because they were kind of let's be cautious all the time, because between Timothy and I, a lot of people passed before me. A lot of people were 6 months in remission, and they rebounds, like you were saying earlier. People rebounds many times. They were afraid I was rebounds. After 12 months, they realized, oh, this is good, and then that's when the London patient kind of start taking shape after 12 months. But the 18 months when my name, my identity, the London patient, it was published at Croy. I felt like, wow, I need to understand more about HIV, because even being an HIV person myself, uh, I didn't know much about it. So now I try to learn more about the research, about more about side effects, about more how people deal with it, different treatments, and yeah, it took me a while, Matthew. It was
Your story is incredible, Adam, because I mean, I was discussing this earlier on today, and I was like, it's like talking to someone who's been to the moon, because you're in such an incredibly rare position that it's like you and I we spoke on the phone yesterday, and we were talking about the COVID vaccine, and you were like, well, I don't know how that would be for me, and it's that thing of like, well, actually, yeah, you're unique, you're genuinely, you are unique. And I mean, I think the message which you give is that it may not be that what happened to you can happen to other people. It may not be able to be rolled out worldwide, but it shows that medical technology progresses and improves, and that there is hope for everybody. Yes. And that is such a powerful message.
It is. And what Susan say about people being vaccine hesitators, I'm one of them. And I said to Matthew in the conversation, I need to have a conversation with the doctors because of all the medical conditions to see how we're going to go for it. But yeah, of course, I want to get the vaccine as well for COVID. But I kind of need to see the facts and to see how I'm going to take it, because in the position I am. And Matthew and Susan, I'm truly humbled to be in this position, and I want to use the platform to talk about it, to kind of give hope to people. A lot of people get despair about HIV, and I want to talk. I want to kind of go around, probably after COVID. I like to go around the world and talk about it, talk to people. People start asking me questions, and they can relate to me. They can feel that way, because I not only have cancer, I have HIV. And people don't realize you struggle mentally as well. The mental health is something people don't seem to talk about it too much with HIV, and that's a huge part of it when you struggle with HIV. I think, Susan, I agree with me.
Wonderful. Well, thank you so much, Adam. It's been truly an honor and an inspiration to have you on. Wonderful.
Yeah, thank you. And one thing to everybody: don't give up on hope. I never did.
Wonderful.
Thank you, guys.
Okay, thank you.
Bye.
Bye. Wow, that's incredible.
It is. We've just met an astronaut.
I know. Well, I think it's time to bring on Let's bring on a star. Hello,
Cindy.
Cindy.
Look, I am so glad I listened to Adam. A lot of people are curious about the cure, and I think he explained it well. That he had cancer, and that's the reason why he was able to be used, for this trial. And he went for it, and he's cured. So it's not something that can happen for everybody. And I've spent quite a bit of time explaining that on my social media pages before. It is a cure, but not everyone's going to qualify for it, and this is why we can't roll it out, worldwide. But I'm happy to be here. Hi, guys.
Thank you so wonderful.
We're so wonderful. Yeah. So
your own show.
So for viewers who don't know her, which I'm sure is a very small number because she is a huge celebrity. It's Cindy Van Zyl. She's a doctor. She's working in South Africa. Now, South Africa has just been named the country with the best HIV policies in the world. Congratulations. I'm sure it's entirely down to you. But
we've worked so hard. I joined this whole program in 2009, and I remember my specific area of passion was the prevention of mother to child transmission. And at the time when I joined the program, 20% of women that were HIV positive and that gave birth would give birth to a child that's HIV positive, right? And now in 2020, that percentage is less than 2%. And this is because, we make sure, especially in the public sector facilities, that if a pregnant woman comes in, she's tested for HIV. She's counseled and she's tested. And if she's HIV positive, she starts treatment on the same day. The public sector is still lagging behind a bit because in the public sector, the doctors and the nurses in the public sector don't always offer the HIV test. But because of social media, because of platforms such as yours, Matthew and Susan, people are aware in South Africa that if you're pregnant, you need to test for HIV. We don't want babies to be born with HIV. I think I'm happy to handle adults because you're grown up and you can handle it. But dealing with a child that's HIV positive is challenging, and it becomes more challenging as the child grows. So adolescents still remain an area of concern for us because many of them, especially the ones that are born with HIV, as soon as they're aware what treatment they're on and the fact that they're HIV positive, they rebel. They rebel, they get angry, they stop taking treatment, and it's so hard to bring them back into the program. And it's because in our schools, when we teach about sexual health, when we teach about HIV, the main message is that HIV is sexual transmission. And we know that's not true. Yes, of course, in our setting, 80% of the transmissions are sexually related. But we have occupational health transmissions, and we also have mother to child transmissions, but we're not teaching that. So you can imagine a 15-year-old that has never had sex gets told that they're HIV positive. They rebel. And I don't want to see that. And I think I have 4 patients in my practice who are going through their teens where disclosure was late in their lives, and they're struggling. And all you can do, Matthew and Susan, is to wait it out. You wait it out. The child goes for counseling, and when that child is ready to restart treatments, then you start treatment again, and hopefully it's not too late. So we've done a great job in terms of putting people on treatment. I think we have 7.5 million people who are HIV positive in the country. And we have about 4 million of those people on treatment, but there still is, a huge number, 3.5 million people who are not yet on treatment. And that's why we have to continue with the work that we're doing.
Oh, absolutely. And that's so important. And I think it's one of the areas where we need to do so much more in relation to treatment for children. And hopefully in relation to injectable treatment, I think that's going to be a real game changer for young people. I'm really excited about that. I mean, this year has been incredible for new developments. How important do you think things like injectable PrEP and vaginal rings are going to be for women?
Well, very important. I mean, when you look at our setting and you look at how relationships are between men and women, the reality is that many women don't have much agency in respect to how sex happens, right? Especially if the relationship is transactional. You can't dictate whether there's condom usage, whether there's testing for STIs or HIV before you engage in sexual intercourse. So, we're happy to embrace the injectable pre-exposure prophylaxis, because it's a depot. You get the injection every 2 months, so you can go to clinic, get your family planning, get the injection, and you don't have to disclose to anyone that you're on pre-exposure prophylaxis. All we want is people to be protected from contracting HIV. Right? And for those that are already HIV positive, we want them to be on treatment, to be taking their treatment properly, and to make sure their viral loads are undetectable so that they can't transmit HIV. So, we're never speaking from a moral high ground where we're saying you will not engage in transactional sexual relationships. We know that those relationships are happening. The economy, just the setting of our country, those relationships are happening. We won't have our head in the sands and pretend it's in the sand and pretend it's not happening. It is happening, but we want to protect young women and young girls from contracting HIV or from transmitting HIV to the partners that they engaging in. And this is why I'm so happy that hopefully in the next 6 months or so we'll have that injectable PrEP in our country. And who knows, in a few years' time we'll have injectable ARVs, and people don't have to go and go to clinics all the time. People don't have to take tablets every day, because pill burden is a reality. People do complain about taking tablets every day. But Matthew, I just need to say this, that your pages are so inspiring. When I look at how many people follow you, whenever you post pictures of your journey with HIV, it's so encouraging. It's so encouraging. So please keep posting your pictures. We love your hair. We love your hair.
You hear that, Susan?
Oh,
Yeah. Thank you.
I love your hair so much. So it's encouraging when people like you speak up, right? Because you have no idea just how much you encourage people. When I get messages from people, I always say to them, follow Matthew Hodson, follow Bruce Whittington, follow Susan Coley. And they're encouraging. So keep at it. We love your hair. Keep posting those pictures from where.
He's actually blushing. It's the first time I've seen him. Yeah, well done. You've made him blush.
Right, okay, we've got to wrap the show up now.
Well, thank you so much for coming on, Sindi. It's been wonderful.
It's an amazing job. You have no idea just how much encouragement I get when I come on, because I'm not happy every day. There are times when I'm so despondent with the treatment that people get in clinics. I'm so despondent when people are misdiagnosed. I'm not always happy. I'm not always encouraged. I'm not always optimistic. But I come onto the timeline, I see aidsmap, I see what Bruce is doing, and I think to myself, you know what? If those guys can keep on keeping on, then I must also keep on until something happens. So thank you so much, guys.
Thank you.
Wonderful. Oh, thank you so much, Sindi. Oh, see you soon.
See you.
We'll have you back on again. Oh. You're blushing.
Oh, stop it. So I just say that actually what this episode has been about, it's been about hope. We've got hope with the COVID vaccine, that there's a light at the end of that tunnel. Adam's story is one of hope that the medical treatment will advance and that we will be able to conquer this. And Sindi, talking about the experience in South Africa, talking about the huge advances that they've made in terms of preventing mother-to-child transmission, talking about even that stuff, the nice stuff about me. I mean, there's been a lot of hope in this show. It's been rather wonderful.
That's brilliant. But unfortunately, we have run out of time. So I'd like to say a huge thanks to all our guests. Sindi, Adam, Tristan, thank you to Disruptive Live for you pulled it out the bag with technical wizardry this week.
And to Wandsworth Oasis, who sponsored this show, and thank you to everyone who supports us.
Okay, thank you, everyone.
We'll be back in January.
Early in January. So have a fabulous Christmas and holidays. Bye.